Hello, everyone, and welcome to our last session of the current book club, which is Dr. Niels Barnard program for reversing diabetes. And today is session 12. And even though we could go on for a few more sessions, we are stopping today. And this has been a really wonderful book club. I hope that you have enjoyed it. I hope that you realize how important it is that we let people know about this life-saving information, that diabetes is actually reversible. They don't have to suffer through it and go from medicine to more medicine to more medicine to more medicine, that things can turn around. But here is the plan. Here's the secret. And of course, we have all these videos for the book club that they're all in my YouTube channel. So today we are reading chapter 12 and 13, and hopefully we will cover all of it, and then I will announce our next book club, and hopefully you will be as excited as me and will register for it. So chapter 12, a healthy heart. So as many of you know, someone who has diabetes has a high chance, very high, of developing heart problems, cardiovascular disease, and among other things, also kidneys, also eyes deterioration and gangrene in your legs or feet. So it is really a very horrible disease, and the most horrible part of it is that I believe that the medical the medical business, I guess, or community has not let patients know this and let the patients decide whether they want to do it or not. But that's another topic. So on page 159, Dr. Neil Barnard says that there are ways that you can prevent heart disease and, if necessary, reverse the disease process. And he also talks about something that Dr. McDougall and many other doctors talk about, and that is that most people in North America and Europe have already developed artery blockages. This is no surprise. It's no news. Of course, we all unless you were born in a family that was already whole food, plant-based, and you have never touched 1 ounce of animal products, then we all have some sort of damage. So by the time that people reach really early childhood, they already have heart disease. Having diabetes increases that risk. Rather than wondering, am I at risk? It is safe to simply assume that you are and to take action to protect yourself. So then Dr. Barnard really gives a very clear, one of the best explanation I've seen in writing, and I want you to really learn this and remember it. So he says on page 160, your body uses cholesterol in the same way a factory might use petroleum. Cholesterol is a raw material, and your body makes many things from it. So cholesterol is actually needed. Believe it or not, cholesterol is used to make certain hormones, including testosterone and estrogen. It is also inserted into the thin cell membranes that surround each cell in your body. So every single cell of the billions of cells that you have in your body is surrounded by a thin membrane that has cholesterol, and it acts as a kind of glue to hold the membranes together. Without it, your body would collapse into a kind of a gelatin, heap. So your liver sends particles containing cholesterol into your bloodstream for yourselves to use. So it is your liver that creates and then sends the cholesterol. Imagine what would happen if a refinery flooded the roads with tankers, sending out far more supply than was needed. Day after day, more and more oil trucks would clog up the roadways. Some might have accidents, spilling cargo and created havoc. Cholesterol presents the same problem. When too many particles of cholesterol pass through your bloodstream, they create a different kind of congestion. The circulating particles can easily become damaged. So cholesterol through your bloodstream is okay to a certain level, but when you have too much of it, they can become damaged, these particles. When they do become damaged, they spark the formation of raised bumps. And those raised bumps that you can actually see in pictures, if you look on the internet, you will see pictures of arteries with those bumps that are called plaque, which are very much like small scars on your artery walls. So your artery walls, they're surrounded by this very thin group of cells. And so you get these bumps on the artery walls. Now, this is dangerous because plaques are fragile. Yes. They can crack or rupture. And when that happens, the blood around the plaque starts to clot, of course. The growing clot can fill the artery like a cork and stop blood flow. If that happens in an artery that carries blood to your heart, a portion of heart muscle will die. That's a heart attack, which doctors call myocardial infarction. The solution to the problem, here it is to reduce the number of cholesterol particles circulating in the bloodstream. Luckily, we know how to do that. Although previous diets had only a modest ability to lower cholesterol, the diet changes described in this book, are dramatically effective. It's very obvious. If you don't ingest 1 milligram of cholesterol, you're not going to have any extra in your bloodstream. You're only going to have what your body produces. So how do you reverse heart disease? Like we said earlier, we all have it. There are ways to know. There are tests that you can do, I believe it's called the C-reactive test, and other tests that you can have done to find out how much inflammation you have in your arteries. And there is a number they give you, and the ideal is that number is 0. but you want it as low as possible, because the higher it goes, the more inflammation you have in your arteries, and of course, the more chances of having serious heart disease. So if you have heart disease, let's assume that we all do. I do too. I didn't eat whole food, plant-based all my life. So we all do. We all have those scars, which are, like Dr. McDougall says, they are, in most cases, they're going to stay there unless they get bombarded and more inflamed with more inflammation. So how do you reverse? It is possible. So Dr. Ornish, Dean Ornish, and of course, and you can find a video that I did with Dr. Ornish and Dr. McDougall in this YouTube channel. And Dr. Ornish, of course, has appeared in Oprah. He has advised presidents. He is one of the most well-known doctors in the world, and of course in the United States. So he's a Harvard-trained physician who made medical history in 1990. He really did. In the year 1990, he made history. Why? Because he showed that a combination of diet and other lifestyle changes could actually reverse artery blockages. His findings were published in the Journal of American Medical Association, Lancet, and other prestigious journals. These studies are not hiding. Your doctor has access to them because they're in major medical journals. They're printed. These studies are there. In his landmark study, Dr. Ornish recruited heart patients from hospitals in the San Francisco area and divided them into two groups. Participants in one group, the control group, were asked to follow their regular doctor's advice about diet and other treatments. Generally speaking, that meant a diet favoring chicken and fish rather than red meat, cutting back on fat, and using medications as needed. The other group, the experimental group, was given a very different regime. They did not use cholesterol-lowering drugs at all. Instead, they began a very special diet. First, because cholesterol is found in animal products, meat, dairy products, and eggs, Dr. Ornish chose a vegetarian diet for the study. Remember, grains, beans, vegetables, fruits, in fact, all plant-derived foods are essentially cholesterol-free. These foods are also free of animal fat, which is even more important. Just to clarify, cholesterol and fat are two different things. Cholesterol is a microscopic ingredient in cell membranes, as described above, and is present in all, not some, in all animal food, in all animal cells. Fat is different. It is the white stripped in a cut of roast beef, the yellow layer under chicken skin, and the greasy residue left on your fingers if you touch a salmon fillet. You can easily see and feel animal fat. When you eat it, your body makes cholesterol. The fact that bacon grease is solid at room temperature is a sign that it is loaded with saturated fat. So any kind of fat that becomes solid in room temperature is going to be saturated fat, which you can think of as bad fat because it raises your cholesterol. All fats are mixtures, and this is also important to understand. Beef fat, for example, is about half saturated fat, with the rest being a mixture of various unsaturated fats. Chicken fat is about 30% saturated fat. Fish fat varies from 15 to 30% saturated fat. Vegetable oils are much lower in saturated fat, except coconut oil and palm oil, which are high on saturated fat, believe it or not. And of course, coconut oil has had a very big press as a healthy oil, and in fact is one of the most damaging oils to eat. You can use it in your skin or in your hair, I mean, anywhere else on the surface, but don't eat it. Some food companies alter vegetable oils through a process that is called hydrogenation, which makes them similar to saturated fats. The resulting fats are called trans fats or partially hydrogenated fats, and they're solid and have a long shelf life, which of course is very important when you're trying to sell food products, and they have to be on the shelf or in trucks for long periods of time. Unfortunately, their effect on your cholesterol level is similar to that of butter or lard. So you can be eating trans fat and hydrogenated fats, which are a combination or a mixture, but unfortunately, they raise the cholesterol pretty much the same way as if you were eating animal fat. They are sometimes used in restaurant fryers and in snack foods. When you see the word partially hydrogenated vegetable oil on a label food, it's a good idea to move along to a better choice or run the other way. Plant foods have essentially no cholesterol and no animal fat. Okay, so Dr. Ornish kept oils to a very, very minimum. The results were remarkable of this study. Among the vegetarians, chest pain rapidly melted away. The average person's LDL or bad cholesterol fell by about 40%. After a year, each participant had an angiogram, which is a special X-ray that shows blockages in the arteries of the heart. And Dr. Ornish compared the results with those of the same kind of test done at the beginning of the study. The results were amazing. The blockages in the coronary arteries, the arteries that nourish the heart muscle itself, were actually starting to shrink. The arteries were opening again. The effect was so pronounced that the difference could be clearly seen on the angiograms of 82% of patients after the first year, all with no heart bypasses, no angioplasties, and not even cholesterol-lowering drugs. So this is a study that is printed in major medical journals available to your doctor. So why didn't anyone tell me? That's what he says on page 165. When Dr. Ornish's findings were published, most medical authorities were willing to believe his program was a very helpful regime, but many felt the program was so austere that few people could actually follow it. I have studied that issue in some detail, Dr. Barnard says, however, and have come to a completely different conclusion. The diet is not terribly austere. In fact, it stacks up well against any other diet a doctor might prescribe. And then he goes on to describe his own experience. So doctors sometimes want to make the decision for the patient and not give enough credit to the patient's intelligence to be able to read and get information and then decide if they want to go with a plant-based program or go with drugs. And that is what I believe is unethical, because we as patients should be able to receive the information, study it, read it, think about it, and then decide what we want to do with our own bodies. So aiming to be heart attack proof. So let's have Dr. Ornish's California Research Center. Let's leave, it says here, let's leave Dr. Ornish's California's Research Center and take a short trip to Ohio to meet Anthony Yen, Y-E-N. Dr. Yen grew up in China, where his family members routinely lived to a ripe old age. For them, heart disease, weight problems, diabetes, cancer, high blood pressure were virtually unheard of. They dined on rice, noodles, and vegetable dishes of various kinds and used meat as no more than flavoring, the way some might use bits of onions, garlics, or pine nuts. In 1949, as a young man, Anthony moved to the United States and slowly gave up his traditional Chinese diet in favor of an American one. As the years went by, he gradually gained weight, like many of his American friends, and he started to develop heart problems, which steadily worsened. Ultimately, he needed surgery, a quintuple heart bypass. Then he was lucky enough to join a program for heart patients run by a surgeon at the Cleveland Clinic. Who is that? Dr. Caldwell Esselstyn, which you can also find in my YouTube channel I interviewed it by myself, and I also had an interview with him and Dr. McDougall. And he aimed to get cholesterol levels so low that heart disease would stop in its tracks. He prescribed a vegetarian diet without dairy products or added oils. He showed patients how to cook and even occasionally hosted group dinners that featured home-cooked foods. He added medications only if a patient's cholesterol level did not fall below 150 with diet alone. And as I recall, Dr. Esselstyn says that if your cholesterol is below 150, you're basically heart attack proof. It's just not possible to have one. That's what he says. So that is the goal that I think we should all have. Dr. Esselstyn, as I recall, was very strict, and if a patient did not follow the diet for the study, this patient was not allowed to continue. Of course, it would ruin the study. Special effect foods. So Dr. Barnard says, there are foods you might want to add to your diet because they can actually lower your cholesterol and protect against the damage that cholesterol can cause. And what are those foods? Well, we all know it's oats, like oatmeal for breakfast, and beans and barley. Some soy products also help lower cholesterol. Certain nuts, such as almonds and walnuts, But yes, they are high in fat as other nuts are, but somehow they have an ability to reduce cholesterol levels that has not been fully explained yet, talking about almonds and walnuts. Fruits and vegetables, as cholesterol particles glide along in your bloodstream, those that enter, and listen carefully here, those cholesterol particles that enter artery walls and cause plaque buildup are the ones that have become slightly damaged or oxidized. You know, when you cut an apple and it starts to get brown, it's because it's getting oxidized. Beta carotene, vitamin C, and vitamin E actually protect the cholesterol particles from damage, so they go on their merry way without harming you. You will find huge amounts of beta carotene in orange vegetables, so you want to eat orange. They have a lot of beta carotene, and those are carrots, sweet potatoes, pumpkin, but there is also plenty of beta carotene in green leafy vegetables. Vitamin C is in citrus fruits, of course, but also in many other fruits and vegetables, and whole grains, vegetables, and beans are healthful sources of vitamin E. It is better to eat the food itself, the whole food, rather than take supplements. That's why none of these well-known and respected plant-based doctors will tell you to start getting pills of vitamin E or of vitamin C. Eat the food, like Dr. McDougall's slogan is. It's the food. So cholesterol, controlling cholesterol step by step. Basically, there are 5 ways to control cholesterol. Number 1, skip animal products, all of them, not some. Number 2, keep vegetable oils to a minimum. Dr. Esselstyn, Dr. McDougall, and many other doctors say no oil whatsoever. But Dr. Barnard says keep vegetable oils to a minimum. So it depends. According to what I have heard doctors talk about, how serious your heart condition is. If you are in need of a quadruple or quintuple bypass, you're in a serious condition, and I would not even touch a drop of oil. So number 1, skip animal products. Number 2, keep vegetables, oils to a minimum, but just note that many doctors say no oil. And number 3, add special effect foods, which we just mentioned. Number 4, if you are overweight, follow the weight loss guidelines that are described in chapter 6. And number 5, is exercise. When your doctor gives you the green light to exercise, you will find it enormously helpful. So what else do we have here? What about good cholesterol, or HDL? The cholesterol in high density lipoprotein particles is called good cholesterol for only one reason. It is on the way out of your body. So the good cholesterol is good. It's called good because it's on the way out. HDL particles scour your arteries walls, picking up cholesterol and eliminating it, like tiny sanitation trucks carrying away garbage. When people begin low-fat vegan diets, their HDL levels sometimes fall slightly, but that is not a reason to worry. Your LDL, bad cholesterol, is likely to fall much more. In fact, some people say that since you have less garbage in your bloodstream, that is LDL, you don't need so many garbage tracks, that is HDL, to halt it away. How do you reduce triglycerides? Triglycerides is a technical term for fat in the bloodstream. It says here, lowering triglycerides is a good idea as it will reduce your risk of heart problems. It is usually easy to do. A low-fat, plant-based diet is a good start, but take one additional step: avoid sugar, white bread products, and other high GI foods, as discussed in chapter 4. So, one solution to many problems. You don't need one diet for diabetes, another for cholesterol control, and a third one for weight control. A diet that skips animal products, keeps vegetable oils low, and favors high fiber, low GI foods tackle all these problems at the same time. Just as a drop in cholesterol is good for your heart, a drop in A1C is too. People who keep their glucose under good control have fewer heart problems as the years go by. And that is the end of chapter 170, chapter 12. Now, chapter 13 talks about having healthy nerves, eyes, and kidneys. These are problems, conditions that diabetics have to be aware of. Healthy nerves is one of them. It's called neuropathy, and that's when your nerves get damaged and you don't feel don't feel things. Sometimes you have numbness or weakness in your feet or hands, and this can become a serious problem. You need to see your doctors if you have nerve symptoms, because it could be diabetes, but it could also be that your vitamin B12 is low, and some of these damages can be permanent. So what are some of the supplements for treating neuropathy? He says the verdicts are not yet in on them as treatment for nerve damage, so I'm listing them here not as a recommendation. He's not recommending that you go and buy these and start taking them, but simply to make you aware of them. Alpha lipoic acid appears to improve neuropathy symptoms. In research studies, a dose of 600 milligrams taken once daily was effective. Gamma linolenic acid is an omega-6 fatty acid commonly sold in health food stores. A dose of 480 milligrams per day, it appears to reduce neuropathy symptoms. And carnitine, in doses of 1,000 milligrams daily, appears to improve nerve condition and reduce pain in patients with diabetic neuropathy. Talking about your eyes, you want to be aware of glaucoma, which is when you have damage in your eyes. And there are several different types of glaucoma. Cataracts also. Retinopathy, okay, your retina. And then healthy kidneys. I believe that keeping your kidneys healthy is very, very important. Your kidneys are made up of millions of tiny filtration units. What do the kidneys do? Well, among the many functions, they keep your blood pure. They purify your blood, sending waste products out into the urine and holding on to proteins and other normal blood components. But just as the retina's tiny blood vessels can be damaged, so can the tiny vessels in your kidneys. High blood pressure, high blood glucose, and high cholesterol assault them, leading to a condition doctors call nephropathy. Okay, so when you have these things that we just mentioned, high blood pressure, high blood glucose, and high cholesterol, it will assault these tiny blood, what did he call it here? Blood vessels. Whether those blood vessels are in your eyes or in your kidneys or in your brain, they will get damaged. Left uncontrolled, kidney damage can progress to the point where your options boil down to dialysis or kidney transplant. The word dialysis makes me like so scared. I can't imagine having to be destined to dialysis for life. I think it's horrible, and it can be prevented. And of course, kidney transplants are possible, but it is not. It's not a game. Okay, it's a serious procedure. If we could avoid all this by changing the way we eat, I think it's much less, dramatic to change the way you eat than to end up in an operating room. First, follow the basic diet guidelines for diabetes as described in Chapter 4. The need is not just for avoiding fat and cholesterol and keeping your blood glucose and cholesterol down, although those are very important. Animal protein is part of the problem too, so you want to avoid it. Since animal protein taxes the kidneys, getting your protein from plant sources helps protect them. This is an important point. So stick with me while I explain. Many people imagine that egg white, chicken breast, plant sources, beans, vegetables, and grains, for example. A low-fat vegan diet is not only free of animal protein, cholesterol, and animal fat, it also helps bring down high blood pressure, which is also important in protecting your kidneys. It goes without saying that you should avoid tobacco. Among its many ill effects, smoking damages blood vessels. So it says at the end of this chapter here that in a recent study by our research team, we tracked the kidney health of our participants. They dutifully collected their urine twice over 2 24-hour periods so we could measure their albumin losses. Your doctor will probably use less arduous tests. They did this before beginning their assigned new diets and again after following them for 22 weeks. During this time, a group following a conventional diet that involved limited calories and carbohydrates had a 21% average drop in albumin losses. Thus, a change in the right direction. However, a group following a low-fat vegan diet had the advantage of consuming no animal protein, animal fat or cholesterol, and its average albumin losses were reduced 56%. I'm sorry if I'm not pronouncing that word right. So it went from 21% of decrease to 56% decrease. They fell to less than half of their beginning values. And then chapter 14 is a very short chapter of 4 pages, which is written especially for clinicians. That means for your doctor. So if you want to make a photocopy of these 4 pages and hand them to your doctor, see if he or she will read them, that would be wonderful. And then after that chapter, you have the menus and the recipes, and there are many here, and they are very tasty, and I hope that you will try them. I made a few of them in previous videos, but that's something for you to try. So our next book club is going to be none less than the famous and much loved Chef AJ. And we will be reading The Secrets to Ultimate Weight Loss. So this book, I don't know how you want to get it. You can buy it anywhere you want. I think that this book is a must in everybody's shelves, library. And as you know, Chef AJ is a dear friend of mine. I have spent so much time with her and her husband, Charles, and we have done so many videos together. And she is working on a second edition of Unprocessed, which was the book that came before this one. And that's going to come out, I think, at the beginning of next year. But I am very excited about reading this book with you, because Chef AJ will join us. And I will have some really good guests in this new book club. And we will have several cooking demos. Some of them may be done by me, some of them may be done by Chef AJ. And I think that if you're looking for a way to finally and once and for all lose those few pounds, well, lose a lot of pounds, or if you have reached that plateau and want to lose whatever you have to lose to get to your goal, this is the book. And of course, this is not just to lose weight. It's also the same diet that reverses heart disease, that reverses diabetes, that will bring your health to be vibrant health. So when you receive the email with the replay of this session, you will see a link there to register. I have changed the days, and the book club will be on Sundays for this particular book club. And it will be at 4 p.m. Pacific time. That is 6 p.m. Central, 7 p.m. Eastern. And next week, we will take a week off next Thursday. And that's the last Thursday of this month. And then the following Sunday is July 4th, which is a major holiday. So I'm not going to do a book club on July 4th when everybody's out and having fun. And we will get started on July 11th, which is a Sunday at 4 p.m. And remember that if you cannot attend live, that's not a big deal. But go ahead and register, because unless you register, the system does not automatically send you the replay. So that's how you get the replay. And I hope you have enjoyed this book club with Dr. Barnard's book. And I know that the next one is going to be another big hit and a lot of fun, because if you know Chef AJ and her personality, you know that when she's a guest, we're going to laugh. So have a great end of the week. And remember that this coming Sunday, June 20th, is Father's Day. And I am presented an afternoon of lovely music from movies. And my friend and colleague, Leonardo, at the violin, and myself at the piano will do this concert. It's going to be short, about 40 minutes, but it's going to be a wonderful way to spend the Sunday afternoon. And I hope that you will join us for that. The link to register for that concert is also going to be in the email. And then when you watch this video on YouTube, it's going to be in the description area of that video. All right. I'll see you soon. Have a wonderful weekend. Goodbye, everyone.